everyone, I am Hannah Cristal Joy E. Bacus from BSN1 11H, and today I am going to demonstrate how to properly do a complete bed bath. So before proceeding further, we should first do hand hygiene. So you have to do hand hygiene. This is to deter the spread of microorganisms. So next is to ensure the patient's privacy and confidentiality. So I have ensured the patient's privacy and confidentiality by closing the door and the curtains. And also I have provided adequate lighting and adjust room temperature for patient's comfort. Next is to prepare the necessary equipments that will be needed beforehand to conserve time and energy. Good morning, ma'am. I am Hannah Cristal Joy E. Bacus from BSN1 11H, and I'll be your student nurse for today. So may I check your armband, ma'am? So your name and your birthday?
March
8. Thank you so much. Okay, now you have to explain to the patient the procedure of performing a complete bed bath. So, ma'am, I'm Hannah Cristal Joy E. Bacus, your student nurse for today. So today I am going to do a bed bath, so which means I'll be washing your body and remove the accumulated dirt and oils or respirations in your skin. So of course, this is for you to feel refreshed. And will that be all right with you, ma'am?
Yes.
So before I begin, would you like to void this time?
Go.
So in the hospital setting, naturally I have to raise the bed in a comfortable working height and lower down in the side rails at my side. So after doing that, I have to assist my patient to move closer to my side of the bed. Okay, ma'am, can you please move here a little? Okay. Thank you. So next is to drape a bath blanket over the patient, then remove the top sheet that is beneath the blanket. So next is to remove the patient's gown. So if the patient has intravenous line, injury or reduced mobility, so you have to begin on the unaffected side. So ma'am, I am now going to remove your gown. Is it okay?
Okay.
So after that, we have to fill the basin with 2 to 3 full of warm water. The water should be 43 to 46 degrees Celsius and checks the temperature of the water. Then you have to let the patient check the temperature of the water and make sure that the patient can tolerate it. Okay, ma'am, can you please slip your your hand in here and tell me if the water is too hot or too cold for you, please.
It's okay.
It's okay. So next is to remove the pillow under the patient's head, and after that you have to place a bath towel under the patient's head and over her chest. So ma'am, do you wear any contact lenses?
No.
Okay, no. So next, you have to begin the bath by immersing the washcloth in the basin. So you have to wring it out thoroughly, then fold the washcloth to form a mitt and wash the patient's eyes with plain warm water, backing the eye from the inner to the outer canvas and using a new section of the cloth for each eye. you like soap to be used in your face?
No.
Okay, no. Okay, after washing the eyes, you have to wash now the patient's face. Wash, rinse, then dry the patient's face, ears, and neck. So next is to expose the patient's arm and place the bath towel lengthwise beneath the arm. Then after that, you have to bath the arm with water and minimal soap. Using long firm strokes, move in a distal to proximal directions, that is from the fingers to the axilla. Then wash, rinse, and dry the entire arm. Then wash the hands and nails. Then you have to raise the patient's arm over her head and slightly support it. So thoroughly wash, rinse, and also dry the axilla. So if needed, apply deodorant to the patient. And then do the same to the other arm. So next is to cover the patient's chest with a bath towel and fold the bath blanket down to the umbilicus. After that, bath the chest and abdomen with your mitted hand using long, firm strokes. Then give special attention to the skin under the breast and other skin or any other skin folds. So particularly if the client is overweight. So after that, you have to rinse and dry well. Next is to check the water temperature. Check the water temperature and change it if necessary. So otherwise, continue by washing the abdomen. So washing the abdomen, so you have to drape the patient's chest and abdomen using a towel and a bath blanket. Then after that, keep the abdomen covered. Wash and rinse the abdomen under the towel. You have to pay attention to the umbilicus and surrounding skin folds. So now I am going to proceed to the patient's leg. So expose the patient's leg farthest from you by folding the bath blanket toward the other leg. Then you have to be careful to keep the perineum covered and place the towel lengthwise under the leg. After that, wash the leg using long firm strokes from the ankle to the knee and then from the knee to the thigh. Also, you have to assess any signs of redness, swelling, or pain. Then after that, thoroughly rinse and dry the leg. Next is to wash the patient's foot clean carefully between the toes. So you have to rinse and dry the foot completely, then apply lotion to the foot. Then after that, you have to reverse the covering and repeat the procedure to the other leg. After that, you have to discard the washcloth and maintain the patient's privacy. Then you have to refill the basin with a new clean water. So next is to assist the client into a prone or sideline position facing away from you. Then place the bath towel lengthwise alongside the back and the buttocks while keeping the client covered with the bath blanket as much as possible. So ma'am, here is the your NG3 So wash and dry the client's back by moving from the shoulders to the buttocks and the upper thighs. Then dry the area and replace the absorbent pad if necessary. Then perform back massage now or after the completion of bath. Then when you are finished, you have to drape the patient with a bath blanket. Gonna roll you over now. Now, I am going to have the patient to put a new gown, and after that, I am going to comb her hair properly, and then lastly, perform hand hygiene. Okay, now I'm going to put your new gown. So that is all on how to properly perform a complete bed bath.